So basically, Exoflow TM. TM means trademark. This already has been approved for COVID associated ARDS. But if you just focus on the trial, nowhere they have mentioned that they are only targeting COVID related ARDS. If you open any SARS-CoV ARDS, they will mention that moderate ARDS due to COVID-19 or SARS-CoV infection. Okay?
So we exclude the COVID also.
Yeah.
We just retain the ARDS.
Exactly. Why will you take COVID right now? So your approach would have been perfectly all right if you would have been doing this exercise way back in 2020 or 2021, because the pandemic was at height. And ARDS was one of the severe symptoms of COVID-19 patients who were landing up on ventilators. So most of the products, especially Exoflow-like products, they got an immediate approval. It's emergency, some EUA. I forgot the full form of it, but EUA, they receive this particular designation and they get the product approved because there's a dire requirement of getting the patients treated. Right now, COVID pandemic is over. And the trial has not mentioned COVID anywhere. Okay? Agar main pura bhi nahi padti, if I just do a search, nowhere it has mentioned COVID. So you need to come up with a justification why you are taking COVID related products in your landscape.
Okay. So there were a lot of other things mentioned also, ARDS secondary to COVID. So we exclude all of that as well. Just ARDS is what we include.
Exactly.
Okay.
And in this case, as this drug is targeting only moderate to severe patients.
You can exclude mild.
Mild, yeah.
The neonatal we exclude, no?
Neonatal is a completely different indication. Neonatal RDS is not ARDS.
Okay.
I think in this trial it is clearly given 18 to 65 year of age. So we should consider this as well, right?
Yeah. You can take age as well.
Yeah, most of the trials were from day one also.
So day one, that is neonatal respiratory distress syndrome. If you read about NRDS versus ARDS, NRDS is a genetic disorder.
Okay, so we will be excluding that, all the trials which are conducting in children's.
No, not children particularly. You need to make sure this condition, the term that has been mentioned here is acute respiratory distress syndrome. If they are mentioning neonatal respiratory distress syndrome, then that's a different category of disease or a disorder.
Okay.
And whenever you face such dilemmas while doing this activity, do a simple search. Neonatal respiratory distress syndrome versus ARDS. You'll get a very clear idea what these two indications are and how they are different. Okay. So
can I ask one more, Doctor?
Yeah.
Okay.
This intervention also, no. In this Exoflow, it says that it is biological. So do we have to include the biological? Because in interventions, there are many biological. Is it possible that our competitors might also be, trying to develop something very similar?
I should ask you the same. Will you include biologicals? If your client products... Did you include or exclude?
No, I excluded, but then I still have that, I don't know what I've done is right or wrong.
So, what was the reason behind this exclusion?
Reason behind is I thought mostly, they might try to develop in drugs rather than biological.
So here your biologics would be a bigger competition than your drugs, right? So whenever there is this biologics versus drugs, we never give an upper hand to any of these because both are basically drugs. It is the chemical version which differs. One is a synthetic version versus biologicals are the one which are naturally derived, right?
Okay.
Both will be given as a drug intervention. It will be given to the patient. It's not an exercise, it's not a procedure, it's not a dietary supplement. These both are drugs. So
Okay.
you might land up some with some synthetic products, synthetic drugs in development versus some biologics. So always include both.
Okay. Fine. Yeah. Thank you.
Okay. Any other questions? All going good so far?
Yes, Shruti.
Yes.
Yes, surely.
Okay. So today we would be working and covering epidemiology. Okay. Let's quickly open it up. So what do you mean by epidemiology? I think we have covered this a lot of times.
It's all about like incidence and prevalence pattern to understand the pattern of incidence and prevalence and which population or group is affecting by the disease, and who, when, and where.
Okay. And how is it useful to us?
It
Why
helps.
do we study epidemiology?
It helps us to decide what potential market have in actual for our drug.
Right. So epidemiology is nothing but the study of patients suffering from a certain indication. Here we need to identify the number of patients which will be our probable market. Okay. So whenever a company is developing a drug, they need to estimate how many patients are available for their drug to take. Right. That is where epidemiology comes into picture. So within epidemiology, we have a lot of terminologies that are used, and each of these terminologies have a different purpose as well as have a different meaning altogether. So the first is incidence. So incidence is nothing but number of new cases suffering from a disease at a particular time period. Okay. So number of new cases of a disease developed per unit time. Now your unit time can be a year, a month, quarter, a day, whatever. So it only pertains to new cases. Okay. Cumulative incidence is number of new cases per person in population over a defined period of time. So you have a defined period of time, let's say 5-year time period. So here, how many new cases have been identified over total population in the period of 5 years is your cumulative incidence. When we talk about incidence, it is just the number of cases, new cases. Cumulative incidence is over a time period within the population. Okay. Prevalence is total number of patients. Okay. So this will include all your old patients plus new patients who are still suffering from the disease. So current number of surviving individual with the active disease. That is prevalence. Everybody clear?
Yes.
Similarly, point prevalence is number of surviving individuals. That means total number of cases at a specific given time. So as of 2023, so how many patients are suffering from metastatic melanoma? That will be your point prevalence. Okay. How many patients are suffering from metastatic melanoma till today starts from the first diagnosis of metastatic melanoma who is alive till today. That becomes your prevalence. Point prevalence, here you just specify
Shruti,
the time.
maybe Shruti, sorry, your slides are not going forward. It is still on epidemiology module.
Is it? Can you
I
see
think
the definitions?
you can see
N-
important.
Now, now it has changed. Important terminology that has come now.
Yeah, that's where I'm at.
Yeah.
Everybody
Okay.
can see slide number 3.
Yes,
Yeah, it was visible earlier as well for me.
yeah, for me as well.
Okay. Okay. So prevalence can be of different types. First is your point prevalence. If you define the time and then you identify the total number of cases, that becomes your point prevalence. Okay. If you define the age, so if you just want to understand total number of cases in adult population, that becomes your age adjusted prevalence rate. Okay. Diagnosed prevalence, total number of people who are diagnosed with a specific disease becomes your diagnosed prevalence. Treated prevalence, total number of patients who have received treatment becomes your treated prevalence. Any questions so far? So these are different terminologies. You'll have to go through them again at your own time to understand the difference. But for now, if I ask you the difference between incidence and prevalence, are you all clear with it? That is the most important category.
Yes.
Yeah. Incidence is number of new cases. Prevalence is old plus new. So total. Okay. So I'll skip the terminologies. You'll have to go through them. How to identify or do your research. I will be waiting. When it comes to epidemiology. So the first step is there is a mesh database on PubMed. That's the best way to identify or go through the epidemiology of a particular indication. Second way is to identify the rates, incidence rates, prevalence rate through secondary. So whenever we talk about secondary research to identify the epidemiological trends within a particular indication, you'll have to solely rely on publications. Okay. No other form of links or supporting web links that you may use will not be taken into consideration because of the validation. So always refer to publications, some predictive publications who may report epidemiology of a particular indication. That becomes your starting point to calculate your epi. Okay. So few of the public sources. These are the websites or databases from where you can get your epi information for a particular indication, or at least a starting point to calculate your prevalent pool or incident pool over a period of time. So there is a certain set of calculation that you'll have to do to understand how many.
YouTube here. I mean, is it a authorized source for whatever we need to look for?
Companies, mostly the public companies, right? They have a certain analyst coverage which goes live on YouTube. You can also refer to them. These are the official statements from the public companies to analysts. Sometimes, in fact, most of the times, analyst reports or broker reports are not publicly available. But companies post out their interviews or these conferences out in the public through YouTube. These are
So how
very
should
rare
we search on YouTube? I mean, what should
Not
be
on
the search?
YouTube, from the company's website.
From
You'll
the
get the
official
link. Yeah,
website.
yeah. There'll be a news publication, news release that this so and so
If
conference has been
mention
done.
these links, if we mention these links in our sources or whatever we are presenting, this will be authorized, right? We can mention them.
Yeah, yeah. The link which company shares through the news release is always authenticated.
Okay. Okay.
It never hurts to revalidate or use an additional link to cross check whatever data that you have that you're getting from the company is actually within the true is actually in the same range as you're getting from publications. So always start from publications. If you're not able to get through publications, which mostly will not be the case, most of the indications are covered very in a lot of detail when we talk about epi. Okay, these rest of the open sources or the subscribed sources can be a way of validation to understand what is the range of patients available for a particular indication. Okay. Okay. So we'll walk through epidemiological calculations through a case study. Okay. So in the case study, they have mentioned in 2012, multiple sclerosis prevalence was 149.2 per 100,000 individuals. Okay. So prevalence was consistent over 2008 to 2012. The US annual 2012 MS extrapolated population was 403 630. What is the prevalence of MS in 2018? So let's try to divide this with what data points do we have. They are saying in 2012, MS prevalence is 149.2 per 100,000 individuals. That means for every 100,000 individuals, 149.2 patients were suffering from multiple sclerosis. Okay, this is the total number of cases per 100,000 individuals. So if the US population right now is of 3 billion, how many patients will we have?
Can you repeat the question?
Approximately.
Okay. So basically, when they're talking about MS prevalence in 2012 is 149.2 per 100,000 individuals. This is the most basic format you will get
Okay.
when you are trying to understand the prevalence. Okay, this is the most basic format of representing prevalence and incidence. So if they are saying 149.2 per 100,000 individual, that means for every 100,000 individuals, so every 1 lakh population, normal people, population, okay, there are 149.2 cases of multiple sclerosis. Okay? So if there are 149.2 per 1 lakh patients, how many will you get for 312 million?
Approximately 450.
So let's do it here.
46 46 lakh 55,000.
So 149.2 for every
1 lakh.
okay, 1 lakh patients. और नहीं इसको ऐसे represent करो. Within every 1 lakh population, we have 149.2. So for one population, how many will we have? 149 divided by 1 lakh. And for 312 million, which is the current population of US, how many will we have? Basic unitary method.
I'm going to 446. 465.
Okay. Any questions? ये मैथ्स है तो थोड़े जो बायोलॉजी वाले if you do not understand let me know. I also faced a lot of problems. Everybody is clear on this, right?
Yes.
Okay. So with 312 million, we'll have 4,65,000 cases of multiple sclerosis. So that becomes your total number of cases suffering from MS in 2012. Yeah. Now what they're asking, so prevalence was considered consistent over 2008 to 2012. Okay. The US annual 2012 MS extrapolated population was 403. So we landed up somewhere in the same range, 403, 630. What is the prevalence of MS in 2018? So, question समझा सबको? They gave us the prevalence rate in 2012. They want to understand the prevalence or total number of cases in 2018. So how will you calculate total number of cases in 2018 with the data that is available for 2012? So here what is